Dr. Stephanie Liu, who's a family physician, also turning 40 this month. Happy birthday.
Thank you.
So let's talk about chronic diseases. First of all, what are the most common ones in Canada?
Yeah, so common chronic diseases examples are high blood pressure, diabetes, heart disease, osteoarthritis, and cancer are some of the most common ones. And you kind of touched on it. As we age, our risk of chronic diseases increases. And we actually know that 85% of adults over the age of 65 will have at least one chronic disease. And that's why it's really important to start talking about chronic diseases and figuring out ways to prevent it, or if you do have a chronic disease, figuring out ways to slow its progression, stop it, or possibly even reverse it.
Okay, so what kinds of things should we be doing to either prevent or to control?
Yeah, so there's a few pillars. So nutrition, physical activity, getting adequate sleep, not smoking, limiting alcohol, and getting appropriate screening. So for nutrition, I normally advise increasing your intakes of fruit and vegetables, making sure that you're having omega-3 rich diet, so eating lots of foods like fish, eating nuts regularly, limiting intake of processed meats and sugar-sweetened beverages. And physical activity, we talk a lot about the benefits of cardio, but you know what? There's also a lot of benefits to lifting weights resistance training because we need muscle as we age. And for screening for blood pressure, diabetes, cholesterol problems, and of course for cancers such as breast cancer, colon cancer, cervical cancer is also critically important.
You gotta go see your doctor to see what you're dealing with. What about protein? You mentioned all the omega-3s and things like that. What about protein?
Okay, so protein is very, very important for our body, and we need to make sure we're getting enough of it. We need enough protein in our body to be able to build muscle, repair our muscle, for our immune system to be working properly, and for us to overall function well. And the amount of protein we need is actually quite a bit. So an average adult will need between 0.8 to 1 gram per kilogram per day. So if you're around 80 kilograms, you'll need 80 grams of protein per day. And we know that as we age, our muscle mass declines. So over the age of 50, we lose about 0.5 to 1% of our muscle mass per year. And we also lose muscle strength as we age. So over the age of 50, we lose between 1.5 to 5%. And so that's why we need to be making sure that we're getting enough protein. Because if we lose too much muscle as we age, we can get something called sarcopenia. And sarcopenia is a significant loss of muscle, and that increases our risk of heart disease, death, poor function, and really impairs our quality of life.
Okay, serious stuff there. Quickly before you go, some people might be thinking, I can't eat that much. What about supplements? There's a gray area for a lot of people. What do you say?
Okay, so supplements is kind of a controversial area in medicine, but I'll tell you guys what I take. So I take vitamin D because it's good for our bones and also can be beneficial for our immune system. I take omega-3s because that can help our brain and also may help our heart. I take creatine because when combined with resistance training, it will help build muscle, which we know is very important as we age. I have a fiber-rich diet, but I also take a fiber supplement to make sure I'm hitting 30 grams of fiber per day, because it's good for our gut health, it's good for our digestion, and it also helps keep you full throughout the day and regulate blood sugars. And I started taking magnesium at night, and that's because there's some emerging data that taking magnesium at night can help you sleep better.
Okay, that's straight from the doctor who is turning 40 soon.
Yes.
And knows all about this stuff. Happy birthday again. If you'd like to follow Dr. Liu online, she is at Life of Dr. Mom. It's time for us to take a break. We'll be right back.